What is up, Sleep Tribe? Welcome to a brand new episode of the Healthy Sleep Revolution podcast. I am your host, Dr. Meghna Dassani, and welcome to our live as practicing dentists. Because as you can see, I am in my office at the office, and our guest today, Dr. Deepthy Thomas, I know she has her background blurred and all beautiful, but I know she is a busy dentist as well. Welcome, Dr. Thomas. It's a pleasure to have you.
Thank you so much, Dr. Dassani. It is a pleasure to be on this podcast. I
Well,
followed you for the past few years and has also had the privilege to be part of your sleep cohort program, as well as your sleep outreach program. I just love this community of like-minded providers you have created and how generous you are with your time and how you share your knowledge with us. So we are all working to improve our patients' lives. So thank you for
well,
inviting me here. I'm thrilled to be part of the sleep movement.
thank you so much, so much. So, yes, we have been connected for a while, and Dr. Thomas is one of those colleagues where you know how you find someone that vibrates on the same wavelength, they think the same way about patients and the quality of care everybody should be getting. So, it truly has been a pleasure to get to know you. Tell me a little bit about yourself and your practice. I know you're a general dentist just like I am. So, just tell our listeners where you practice, what kind of a practice you have, and then we'll jump into our favorite topic, sleep.
Sure. I practice in San Ramon, California. I've had this practice since 2008. This has been my baby, so it's called Reflections Dental Spa. We've always catered to making the visit so comfortable to our patients and, just trying to kind of step away from what is normal out there. So that has been our marketing. That has been how we have differentiated ourselves. And now we are more and more becoming airway driven. So it's just, things that I can help. I mean, how can I change my patients' lives is basically what it is. Once you find something, then you can't just stop doing it. So that's where we are. So I'm all excited to find somebody who's very like-minded and a fellow like I am. So awesome. Thank you.
Yeah, and isn't it the truth though that, at first we were like, oh, Airway, we thought it would like be its own standalone entity as a treatment procedure that we did. But I know this is a conversation we've had many, many times. It's part of the dentistry that we do. And a lot of times for a lot of patients, we are often the first providers that notice the signs, right? Have you noticed that?
That's so true. And you get to see them as like, no, I sleep good because they don't know any difference. It's just that's what their normal is. Like they always ask, why do you ask me? I'm like, okay. So then you have to tell them all the findings in your mouth, what I'm seeing over there. These are, signs that we usually associate with apnea. And then it kind of gets them to think. And at least even if it's just a little seed in the beginning, it's great to just chat to them and get them to be aware of, there is a solution. There is something better that you can have. So
And it may not be them, right? It could be a family member that they might be able to shed light upon what's going on. Or I remember we had a patient who was like, we always talk to him about it. And he's like, Doc, I don't have anything. I'm sleeping fine. But turns out the one day he was talking to his neighbor while they were like mowing their yard or something. And the conversation happened. And the next thing I know, his neighbor is on our schedule for a consultation because something they said to each other really struck a nerve. So we have all these stories, don't we?
yes, we do. It's great to be, to be at least that person who brings attention to this. And, even if it's not with me, sometimes it's severe. Just to have the physician take a look, they have this trifecta of high blood pressure, high cholesterol, heart issues, uncontrolled diabetes, and they're just struggling with this. To just know, are you sleeping good? Is this something? It's like, oh, no one has ever asked me, and nobody wants to listen to me about that. So I think we can go in a tangent just chatting about how many people we come across every day.
Exactly, exactly. So tell me, how did you get into sleep? I've shared my personal story on the podcast many, many times, but how did you get interested in sleep and what has your journey been like?
So I did not get into because of a personal reason. It's mainly because I see a lot of adult patients in my practice, and I have been doing Invisalign since about 2009. The interest came because some of my patients who were getting treatment, especially the ones who had a lot of crowding, who had narrow arches, they were getting uprighting done, and they're getting beautiful full smiles, and they would come and tell me, "I love my smile, but also I'm not snoring as much. I'm sleeping way better." I'm like, okay, so their spouses were like so happy with both the outcomes, of course. And that got me interested in like, okay, there is something here that is an airway-oriented orthodontics, even though I wasn't really looking at it. I was looking at the smiles generally. But I wanted to learn more about sleep and snoring and find out, okay, is this something which I can help my patients with? As far as snoring, who does not have people that who snore? I mean, personally, I always thought it's annoying, but it's just normal for people to snore. I mean, I hear it from everywhere. Oh, I just snore a little. I don't know what a little is. So,
Or, oh, only when I'm tired.
only when I'm
Okay.
tired or if I have a drink, So there's different reasons. My husband used to snore, so I would just turn him on the side. So I was doing a little bit of a positional therapy for him. And my
Yes.
deal was I have to fall asleep before he turns back. So it doesn't trouble me. And then, of course, my son, my little man, when he has had years of orthodontic treatment. He has like anterior cross bites, and he's always had breathing issues and allergies. He's a mouth breather. His nose really doesn't work very well. And then he has a tongue tie. I mean, I could not really help him when he was, that young because I wasn't aware of it. But it's definitely motivated to me, like, if I can find answers to help my family and my patients, if I can catch them when they're young, they don't have to go through this whole process. So that was good. So I decided to kind of go on this quest to find out how do I learn about sleep. So I started with the UCLA Sleep Continuum. I did for a year. I mean, I think I might got my brain bombarded with so much information. I'm like, ATI, RERAs, what is all this? I was trying to read books, then, it kind of, you get all this knowledge. How do you bring it into your practice? Like, okay, great, I have all this knowledge. So I think I probably scared a lot of people in the beginning.
Because we get so passionate, right? I want to tell my patients everything I know because I'm like, if I see how important it is, maybe you will also see it.
Yeah. And then, of course, I was part of your cohort. And then I've taken like a TNJ and sleep therapy center with Dr. Almos to see how to manage that, because you always see this connection between TMJ and sleep,
Correct.
headaches and migraines. So then, it's not always, but still, it's a big part of it. Then I'm part of the Air Institute because then trying to find like-minded groups. So you go to like the Air Institute, like there's Dr. Skinner, Dr. Zelk, and Dr. Downs. They're always trying cutting edge things to see how to help patients. And then I did a lot of Photona. I have a Photona laser. So with them, they do a lot of how do you improve patients' tissues, tightening the intraoral tissues, how to get them to breathe better. I'm doing a mini residency with Dr. Audrey Yoon, just so I can be more aware. I don't really see many pediatric patients, but I just want to be aware, where is the need? I mean, how can I help? At least educate them and kind of guide them to the place they need to go. And, I'm trying to do like the Spencer Study Club and part of the AADSM so I can get like a certification. So, when I come across to people, at least they know, hey, I'm serious about this. So I guess I'm very much of a nerd.
I think we all are. Just the fact that, there's so much to learn. I'm always saying like it's still the Wild West in the world of sleep because we're still learning. There's new research coming out every day. There's so much to learn. I always say this, the day I stop learning, it means like I'm dead. Like
or my brain is dead.
Right? Exactly.
I'm a lifelong learner and I always say that your eyes cannot see what you don't know. So you have to, I found that the more I know, it's like the more I don't know. So I have to keep learning. I mean, you have to, you have to understand it more. And then, you cannot kind of push it down people's throats. I just have to tell them, this is where I'm coming from. Are you interested in learning more?
Correct.
And then I kind of leave it to them. So, okay, I see some concerns, but hey, if you don't want to hear, I'm not going to talk about it, but please at least go check it or with the apps and things that are available. So can you please download an app? Just at least look at it and see what it's
data. Yeah.
So
Yeah,
that's
for sure. No, knowledge is power because I always say, if I'm not able to help you, at least I know who can help you. I can find you somebody that will have the answers because none of us have all the answers. And I think it's incredible the amount of effort, time, money, energy that you are putting into educating yourself. Your patients are lucky to have you for sure.
Amazing. And thank you for being a great resource out there. And for me, I didn't think I had a problem because I never snore. I'm like a side sleeper, and I wake up side sleeper. I don't really move around. But you work so hard. You always think, oh, I'm fatigued because I didn't get to sleep. I go to bed at 2, 1, depending on the work. But then I got tested, and I have what they call UARS, the upper respiratory syndrome, where it's very common in women. So if you test them, it'll say you're negative. Like if you look at the AHI, it doesn't really show that because because you're not having so much desaturation. Your oxygen levels are okay, but your body is just fighting to kind of breathe properly, and you're just tired. It's like you were running a marathon the whole night and you just don't get the
And
rest you
especially
need.
women, we get told, oh, you're doing too much, right? It's
Yeah.
like, oh,
Yeah.
you're running behind the kids and you're a busy practitioner and you're doing this and doing that. And add to the fact, if you're not overweight or you don't check those boxes that
Yeah.
traditionally we think someone with sleep apnea should check, then it's very easy to get
Yeah.
overlooked. Yeah.
Yes, it's so it's right now very personal because I can help my husband. I need to help myself. I had to help my children, and then just in the process, even in the future, to get them, even if they've developed into these little mini adults with all the issues, but we want to kind of try and help them have better life. So definitely, I'm always reading about it because this is one thing I can do to help my immediate family, and of course, by extension, all my dental family is my family too.
Yeah, yeah. But you know, life isn't always a bed of roses, right? On this journey, I don't know about you, but I've had some pretty, I shouldn't say significant, interesting challenges that I came up against when I got into this. Have you faced any of that? Like being asked, why are you talking about sleep? You're just a dentist. You're not my sleep MD. Or have you faced anything like that?
I have, especially for my patients who've been with me for a while, because once you learn and you bring in Vaisho, she's on a next tangent now. Because they're like, oh, she'll stop after a while, but to their surprise, I have not.
That's funny.
So it's, because for us, I mean, they really don't know what poor sleep looks like, right? They're not ever, if they're not aware, they're very stubborn. Like, they're like, no, I don't have an issue. Don't tell me. They just don't want to know. Or, because we see all the narrow arches, we see the scalloped tongue, and we look at the throat and it can barely visible. The tonsils are almost touching. And they said, oh, they have always been told I have big tonsils. Like, no, you're not breathing. And then, they're fogging up the mirrors like, oh, no, I breathe through my nose. But they're like, I can't even look in there because the mirror is getting fogged up. Or the teeth that they're developing, you have these narrow arches or this open bite with the tongue thrusting. It's like, oh, I always had that. I just talk like that all the time. So it's just to kind of let them know, hey, no, that's your body kind of giving us a flag, like, oh, hey, I have an issue, help me, even though you're not aware of this. Or they'll come and say, oh, I broke this tooth, I broke that tooth, I have clenching, I have muscle pain, I wake up in the morning and everything is sore. So it's like, okay, have you ever tested to see if you're sleeping well? And then it's just, at least a start. I mean, I always tell them it's usually multifactorial, but we at least need to kind of start somewhere and make sure that this is not why your body isn't resting. This is why you have issues going on. Anyway,
Yeah.
that's been great. And then of course, the process as a dentist, I think it's still, I mean, like you said, it's the Wild West still out there. So, everybody's trying to hold on to their little domain. It's almost, I think we need to come out of there and kind of have a teamwork where we cooperate with all the physicians and sleep physicians and kind of have this multi-specialty just to help our patients so they're not getting the runaround. Just going, okay, because if we send for a sleep test, it's just sometimes that's all I hear for. Then I never see them for a long time because either they got pushed into a CPAP and they're like, oh, I have a CPAP, I just don't use it. It's there, I use it, yeah, sometimes. It's just I can't tolerate it. But because they already got a CPAP, then they cannot really have any other option or insurance and all these gimmicks sometimes that come with insurance. So
Yeah.
those
Yeah.
are
There's a lot
all
of hoops to jump through
issues.
at times.
Yes. But, you still have to try to start somewhere. And, at least in the Wild West, we get to be the pioneers to make it easier for our next generation.
Absolutely, absolutely. Let's segue to a couple of topics that you and I have had really great conversations on lately. One is I know you're very passionate about nasal breathing with
Yes.
your patients.
Yes.
And then the other that I know we are constantly evaluating with our patients is the tongue. So let's start with nasal breathing. Just tell me, I know it's a passion for you, so I'll let you take it away from here.
So I know at this point in my life, I never thought I'll be talking so much about the nose because you think it's a completely different cavity than what we have experience with. But we kind of, have become such a big proponent of nasal breathing. If people have, make sure your allergies under control, there's no structural issues. I'm constantly saying, please go see your ENT. If there's anything going on, I'm still working to find a network of like ENTs and other physicians who actually are in the same category. I just don't want to send somebody to your ENT and they say, oh, no, everything is great. Everything is great. And I say, okay, you are not even breathing. Your nares look like they're like tiny slits. You get your panos or your CBCTs and like, okay, it looks like deviated septums. And so, so I have started looking more at that and tell them, okay, you have to find somebody who will listen to you and make sure that is doing well. In the interim, I'm recommending these clear sprays, the Xlear sprays to kind of help with,
Yes.
nasal dilation. Always talking about any kind of nasal dilators or you breathe right strips. And so many people, they must have heard a gazillion times, my team, about the importance of how important it is that the air needs to go through the nose, through your sinuses. You get this nitric oxide, brings down your blood pressure, gives you the sense of wellness.
Yeah.
I mean, I think they're all like, okay, we've heard it. I think they all know it by heart now.
But that's the way it should be. We should all be having these conversations.
Yeah. So especially if they're young and it's in their formative years, if I can get them to, do this when they're young enough, then their jaw develops so much more beautifully, so much more nicer. And they don't have this lifetime of issues that we are facing right now. I know. So I wish we kind of could say we could specialize in that little area too.
I know.
But I've made life so much more easier. But hey, I mean, I'm sure there are great ENTs. I just have to figure out a way to like work with them and kind of mutually help each other.
Correct. It takes a village truly to help our patients.
It's
We
not
need
a one-man show. It's not
a
just
team. It's a team for sure. Yeah.
and of course the tongue.
Let's jump into the tongue. I know evaluation of position and all of that is part of your exam.
Yes.
Tell me your thoughts and just what are you talking about with your patients when you're assessing the tongue position?
So I'm looking at the Malampati score first to see how big does the tongue look in the mouth. Does it look like it belongs there or is it just trying to escape? I tell them it's the tiger, that's its cage, and everything else. If the cage is small, it is going to escape from one way or the other. Go forward, affect your teeth, back, it'll fall into your throat and affect breathing. So I'm talking about it all the time. So sometimes it's more of the position. I don't see as much of a tie when I look at that. It's more of, okay, you're not used to keeping your mouth in that area. It's like all this habitual muscles that are in there. And this is where they belong. They've talked like this. They've learned to talk like that. And sometimes I have to tell them, okay, you might have to actually go find a speech therapist to help you because I can see in this 5 minutes we have talking, I can see your tongue coming out of your mouth so many times. That's just not the way it's supposed to. It's supposed to rest on the roof of your mouth and you're supposed to swallow with, good position. And if there is a tie, I'm telling them, most of them, oh, never been told I had a tie. So then I have to talk about, okay, let's start with some myofunctional exercises. I have this little QR code with stretches I make everybody take a picture of. Like start with this. And once you get comfortable with this, there are, virtual sessions that are not too expensive or because if I'm trying to get them to start looking at tongue tie, they're not going to jump into a tongue tie release. I want them to, it's more about position really, right? So if I can get them to be flexible enough that they are doing better, then I start from there. And then if there is like an apnea or other issues in the side, they have a tongue thrust going on, open bite that is not closing, then I start talking about we might want to look into this. But I always start with the myofunctional exercises. I personally don't do releases, but I have a periodontist who's in my office. He does them. So the goal is to really improve the tone and how to improve the mobility of the tongue. So it can maintain its position and support the airway during sleep. So in children, of course, it helps in jaw growth too, which is a great, I tell them the floor of the nose and the roof of the mouth is the same. So anything that you can do to help form it better, you're going to breathe better. So it's great.
Absolutely. And besides, the protocol is we want to have myofunctional therapy before we release the tongue. So it's a great place to begin. So you can kind of segue into that.
I am excited because I have a pediatric dentist joining because I really don't have a huge pediatric patient population. So she's joining. I know we're going to get children in there and I can talk to the parents, I can increase awareness and hopefully can put some steps coordinating with her to, to intervene and prevent some issues. That would be awesome because, as you know, there's so much correlation with, with sleep issues and failure to thrive when they're young or they have ADHD and those kind of issues and or young kids who have nightmares and they have
bedwetting is a big one too, right?
Yeah. So, I mean, it's kind of embarrassing for the children, but there is actually a physical reason. It's your body waking you up so that way you can breathe. Breathing trumps everything. I tell everybody, I can move your teeth anywhere and everywhere, but breathing trumps everything. So that's been great.
Amazing.
Yeah.
I have one one last question before we start to wind up our episode. You mentioned night lace earlier in our
Yes.
conversation with your laser. Go into what is night lace for our listeners that may not know what it is and what are some of the benefits or how you use it in your sleep practice.
Sure. It is one of the tools that I use. So, I have a few different, of course, I start with nasal breathing. We evaluate everything. Night lace is one of my first line defenses because even if you go into any other like a mandibular advancement device, or if you're going at like, even if they're going for a CPAP, they have a CPAP, I feel like tightening the tissues everywhere would really help in not needing so much advancement and not needing as much pressure in the oxygen because your tissue is doing better. So it is a non-invasive laser therapy. I do it using my Photona laser. It's a dual wavelength laser. So there is the Nd:YAG laser, which warms up and just, tightens tissues in general. And then you go back with what we call the erbium part of it to build collagen in those areas. So we're mainly going to the back of the throat, the soft palate, the tongue, the tonsillar areas, just to tighten things up. So what you can I tell people it's like cool sculpting. I don't know if you're familiar with, a lot of people are because people want to lose weight. You go with the cool sculpting laser to kind of kill some of the fat cells, and then it really builds collagen in there. It's a very similar process. So you just kind of slimming down your tongue a little bit and slimming down your soft palate. So there is more volume, more space, and the tissue tone is better. So you're functioning better. So
And
that's
just for our listeners that may be joining in, this is a non-cutting setting. She's not taking away any tissue. It
exactly.
is, the
There's no really pain or post-op. It's just maybe you
correct,
feel like a hot coffee. You drank a hot coffee. Sometimes it can feel like, I think I had it a little too hot. That's usually how it feels. And each
correct.
session is about 45 minutes or so. And then you usually need minimum about 3 sessions. And everybody's a little different. I don't tell them this is the solution. This is one thing that I can do to make life a little more easier in that area. And then of course, there's supplemental things that you do with it. But there is really not any downtime with this. So it's very,
Correct. That's
one of
important
the
too.
things that I've seen popular. Not very many people are doing it. So I do get people coming wanting to try nightly.
That's amazing. How can our listeners find you? I know you said you practice in California. Do you want to share like your office website or social media handle so people can go follow you, your practice, and everything that you do?
Yes, we are in San Ramon. My office name is Reflections Dental Spa, and our Instagram handle is the same hashtag Reflections Dental Spa. We also have a Facebook page for requests and everything, and we are working on doing something specific for sleep to kind of make it more focused. But at this point, this is a great way to get to us. You can email us at contact@reflectionsdentalspa.com if you need any information. We do offer free consults for our
That's
sleep
beautiful.
patients so that we could come to see us, kind of see where you are, and then we can go from there.
Perfect. So for our listeners, I will be dropping all of this information, as always, in the show notes. We'll have Dr. Thomas's bio, her website link, Instagram handle, the email, any contact information, practice phone number, all of that fun stuff. So don't be scrambling to write it down. We will have it in the show notes. So Dr. Thomas, as we wind up our episodes, and you know this, we ask all of our guests this question: what are your top 3 tips for people that might be listening in, for people that are either just getting started on their sleep journey or have questions about this? What are your top 3 tips?
Okay, that'd be awesome. Okay, so the first one would be find your answers. You should find solutions, be your own advocate. If you or your loved ones are fighting with fatigue and tiredness or lack of sleep and energy, and then you cannot tolerate a CPAP, just don't take it as, that's the norm. Oh, of course, I tried. Keep trying. If you can get the restorative sleep that you need, it'll keep you healthy and looking younger. And you can face tomorrow head on and just enjoy your life. There is no one answer. If you can't tolerate one, there is always other solutions. We can find you one to help. The second would be breathing through your nose. It is so important. Let's put this organ that is specifically made or specifically created for that to full use, So our mouth can do other things. We can talk, sing, and eat, and do all other things that's supposed to do. And then the third one would be, I know we are a dentist, but we care not just about teeth. We are here to help with your overall health. And this is paramount to a better quality of life, and your lifespan. We just like to leave you with a beautiful smile too, but that doesn't mean we don't care about how long you live and how effective and how how much of a good quality of life you have. So that's
It was amazing. I'm very inspired today. Well, friends, for those that are listening in, some great information, great tips that Dr. Thomas has taken time to share with us. Please share this episode. You know you have a loved one, a friend in your life that could benefit from this. So share this episode, hit that like button, follow us, and go follow Dr. Thomas on social media as well. Lots to learn. Leave us a review, and we will see you next time. Dr. Thomas, thank you for
Thank you
coming
so
on
much.
your day off, spending some time with us. I know there's tons to get caught up in the practice, but I truly appreciate your time.
Thank you so much for your time. Let's make everybody breathe better.
Absolutely. All
Thank
right. Bye, everyone.